Hi, I'm Dr. Kerry Fierstein, Chief Executive Officer of Allied Physicians Group, practicing pediatrician for over 30 years, mother of 3, and now grandmother of 1. I'm here with trusted pediatric advice, newborn edition. Today we have the 1-month exam. So at 1 month old, we have a very different baby than we had for the newborn. He's more alert, he's looking around. Hi, and we might even be able to get him to smile. Hi, baby. Yes. He'll talk back to me too. If you look at his color, he's much less yellow than he was. If there's a little bit of yellow left in a breastfeeding mom, that's pretty normal. You can certainly ask your pediatrician about that. He's still gonna have a little bit of head lag when we go back. That's totally normal. Each month when you come, that'll get a little bit better. Soft spot's still there. Remember, that's there from 9 to 18 months. His head should be nice and round in the back. It might be a little flat. That's okay. You just want it even. If you're finding that it's much flatter on one side than the other, make sure to lay him on the other side when he's awake. When he's asleep, he still has to stay on his back with nothing in the bassinet. But during the day when he's awake, you can roll him one way or the other, and even put a little towel there to keep them. At this age, they often have a little bit of baby acne. Very common. You don't need to do anything for that. That'll go away on its own. Eyesight, baby's eyes still cross at this age. Very disconcerting to watch, but very normal. He can see about 12 to 18 inches away. So if you want him to focus on you, you have to get very close. Hi. Hi, yes. And even then, he'll only do that maybe certain times of day when he's in the mood, when he's not too hungry and not too sleepy. Sometimes babies get a little green in their eye. That's because the tear duct isn't completely working, so just wipe that away. If the green keeps coming back, that's something to talk to your pediatrician about. Their nose can get a little stuffy. They sound very noisy when they breathe, but if they're feeding well, then their nose is doing what it needs to do. Because if you put a bottle or a breast in the mouth, they have to be breathing through their nose. So if they're feeding well, the stuffiness bothers you more than it does them. If you see a little booger, you're certainly welcome to take it out. That's a parent's prerogative. Sometimes the tongue can get a very white, thick coating on it. Most of the time that's just formula or breast milk. If the baby is feeding well, I wouldn't worry about it. If there's any pain with breastfeeding or the baby isn't feeding well, then talk to your pediatrician about thrush. Sometimes the baby's nipples can still be a little swollen. That's usually maternal hormones. Breastfeeding or not breastfeeding, that'll continue to go away. By a month, the cord will be off. The belly button should look good. Babies don't have a lot of good stomach muscles, so their stomach will get full at certain times of the day, and when they poop, it'll go down. Babies also get Cradle Cap. If you notice that there's thick scales on your baby's head, that has nothing to do with hygiene or how often you clean them. They will probably go away on their own, but if you'd like, you can put a little baby oil or coconut oil or olive oil in their hair about a half an hour before you shampoo them, and then after you shampoo them, just comb it out with a fine-tooth comb. At this age, you should be putting the baby on his belly and doing a little bit of tummy time. He may only tolerate it for 30 seconds a minute, and that's okay. It'll help him strengthen his neck muscles. Babies develop from the head, down the neck, then their trunk, and then the bottom, and that's why they sit before they walk. So a little tummy time every day, maybe right after you change him for 30 seconds. Most important for development at this point is that you talk to babies. And you talk in something called parent ease, which means you talk a little sing-song and you say, "Hi, baby, how are you?" And this is a good time to bring out some of the nursery rhymes that you remember your mom singing to you. 5 green and speckled frogs sitting on a speckled log, eating some most delicious worms. Yum, yum. We'll teach them the rest of that later. This is our 1 month exam. We'll see you at 2 months.